Hi, my name is Kathleen Nicely with TrippNT. I'm here today with Logan Threet, a CST with over 24 years of experience in the operating room.
I was going to do a little demonstration of how you can fill up one of the racks of the cart, discuss some of the pros of the suture cart that you guys see here in front of you. A couple of things are some of the different suture boxes you guys might run into in the operating room or other departments. We have these smaller ones or these taller ones. So we know that this can hold 96 of the smaller units and it can hold 48 of the larger suture units as well. But as far as storing these, stacking them, I'll just kind of walk through what some of that looks like. One really big pro to this particular cart is the height that it gives you, and that all of your shelves are slanted. So as you're pulling suture out, things aren't likely to fall out onto the ground. You'll find these smaller boxes that we're able to stack those up 2 at a time. You have plenty of room for larger boxes, so larger ortho pop-off sutures. You may have things that are like umbilical tape that you have to have that'll also fit directly in there. Another thing that we like about the suture cart, again, that it is double-sided, that it does offer a storage area here and then an enclosed case here at the bottom for other supplies and other items that you might need throughout a surgical procedure.
Logan, how do you think you've seen this cart make work easier in the field?
I think the cart is, one, it's extremely lightweight, very easy to store. So if a facility or you wanted to store it this way, or if you're saving space, storing it this way. A couple of other things that are really nice when you go to restock is your wheels are lockable, so it's not going to go anywhere, or it can be locked during a surgical case so it doesn't roll anywhere. And then again, as I mentioned before, all of your shelves are slanted, which is a huge advantage to a suture cart, is having them slanted, so you're able to grab a suture, pull the suture out, and not run the risk of it actually falling out and hitting the ground where we'd have to throw away or waste. So I think a lot of the specialties where you're going to see this cart is general surgery, orthopedics, eye surgery would be another large one, GYN surgery would be another large one, plastics is another one where a lot of sutures required and has to be on hand or has to be outside the room, and this kind of answers the call for all of that. So you've got a very large variety, you've got a large quantity that you can have close by, which your nurse and the team that you're working with will appreciate that you're not having to run across the hospital to grab a certain item.
Logan, we really appreciate you coming in to talk about this cart with us. We appreciate your time and all the new information that we have.
You're welcome. I'm very excited about the cart, what it has to offer and what it can offer for facilities all over.